I've never been invited to speak for more than 8 hours at a time. So every time I speak, I have to figure out what content can I use for 15 minutes? And the answer is simple, but it's not easy. And the answer is, where is my audience on the spectrum? The spectrum starts way over here. This is single payer shimmering on the horizon. But before people are going to pay any attention to single payer, they have to understand one step back, what's universal care? Because single payer is the best way of getting it. But before people are going to care about what universal care is, they're really back here, which is what are we trying to achieve? What are the options for which universal care is the best solution? But before people are going to consider the options, they're really over here, which is, what's the problem? And before you can get there, they might be over here saying, we don't have any problem. Now, how can you tell where your audience is? Well, you can start taking the temperature by asking a question. Who here would agree with the statement, it may have its flaws, but the United States has the best healthcare system in the world? Okay. Not enough people here watch Fox News. When Obamacare was being rolled out, there were 24 Congress people and governors who said the United States has the best healthcare system in the world. If that's where your audience is started, then that's where you should start too. What's the problem? The problem is we pay too much money. We're the most expensive healthcare system in the world. Our public health is the worst in the civilized world. And we're bankrupting families and ruining businesses. There's one 15-minute presentation. Now, you've moved people over to the next position, which is, we have a problem. I understand. And the question is, what are we trying to achieve? There are a lot of weeds here. Well, what we're trying to achieve is get the profit out of healthcare. We're trying to put the profit into healthcare. Or we want government out of healthcare, or government into healthcare. Or we want more personal responsibility, or we want less personal responsibility. Here's where you fall back on what Larry just told you. Our goal is access. You want your family to have access to healthcare when they need it, no matter what your bank balance is. You want your costs to go down. And remember, whether you're paying taxes, premiums, or out-of-pocket payments, it's all your money. That sum total has to go down, not just relabeling it. And finally, we want better health care. We don't want to know if a member of our family gets pregnant. There are 60 other countries where she and her baby have a better chance of surviving the pregnancy. Better care to more people for less money. Now you brought them to number 3. All right, we know what the goals are. What are our options? Well, there are 3 basic approaches. And you can sort of, the first option is to keep doing what we're doing and hope for a different result. That, unhappily, is the Affordable Care Act. It changes the rules, but it doesn't change the game. Our basic system still says, if this person gets more care for less money, someone else gets less care for more money. It's a zero-sum game. The second option is to experiment, to try things that have never been shown to work in healthcare. And maybe they'll work. Maybe health savings accounts will work. Maybe vouchers will work. Maybe block grants for Medicaid will work. Maybe consumer-driven healthcare will work. Maybe they will. If we make that work and get better care to more people for less money, we'll be the first country in all of civilized history, all of recorded history to achieve it with those. The last approach is, why don't we look at systems that already provide better care to more people for less money and learn from them? That's where the healing of America comes in. It's easy to find another place that delivers better care to more people for less money. Just leave the country. Every other place where you can drink the water delivers better care to more people for less money. So that brings us to, what can they teach us? Because they all look different. Every country has come up with a different answer. What they all have in common is right here, universal care. They all manifest it differently, but they all use universal care. So what's universal care mean? Well, 3 things. Notice all of this comes in triads, makes it easy to remember. The first is everybody in, nobody out. It's actually more than that. You can't even opt out. In all of these universal health care systems, nobody can be excluded, not even if they want to be. You can't tell the government, no, reduce my taxes by 10%, I'll take care of my own health care. Nope, can't do it. Or tell your employer, don't pay my insurance company's premium, give it to me and I'll take care of my own. Can't do that. So it's one risk pool. Second, it's one comprehensive policy. Now, you'll get into this discussion about what's basic care, what's essential care, what's comprehensive care, what's catastrophic care. An easy phrase is treatable conditions are treated, and everybody's included in that. If you've got more money, you can buy more, you can buy experimental meds, you can buy non-approved treatments, you can buy private hospital rooms, but you can't buy less. You can't say to your insurance company, charge me 25 cents a month less because I don't need maternity benefits. Everybody has the same comprehensive policy. And the third factor is any patient can see any provider. And providers are paid based on the value of the service they provide, not on the patient's insurance status. So it's one risk pool, one set of benefits, one network. Now you've got them over here. Single payer turns out to be the most efficient way of providing universal care. If you've got your audience over here, you can go over the horizon and now you're organizing. If you can figure out where your audience is along this spectrum, you can then pick out the niche for the content of your speech. Each one of those little blurbs that I raced through can easily be expanded to a 15-minute presentation. Don't try to go from here all the way over to there in one presentation unless you talk real fast like I've been doing. Just focus on one area and take your time doing it. What are the 2 questions that you're going to be asked every time you talk about healthcare reform? Okay, let's right there.
How are we going to pay for it?
Actually, how are we going to pay for it? Actually, you will be asked that. That's not one of the 2. The answer to that question is you're already paying for it. The United States already pays more than it needs to provide comprehensive health care to everyone. We're not getting it because we filter it through insurance companies. So the issue isn't how are we going to pay for it. The issue is how are we going to divert what we're already paying in premiums and out-of-pocket payments into a place where it actually gets turned into health care. Good question, though. There were other suggestions here. Yes? Question, will my taxes go up? If you can get to single payer, if you can get to universal care, there are some countries that don't pay for it with taxes. They pay for it with insurance premiums. If you're going to pay for it with taxes, yes, everything that you're currently paying in premiums and out-of-pocket payments will be relabeled as taxes. Now, if increasing taxes is absolutely unacceptable to you, and you have the option for a single-payer system, then you can explain to your family why you are going to turn down a program that provides better care to more people for less money, that assures them access, reduces your cost, and prevents them from going bankrupt, because you object to writing a check that says taxes on it rather than premiums. For many people, that's important, and we'll honor that. But we don't, all we need is 51% of the people to agree. The two questions, I love this guess what I'm thinking kind of game. The first one is universal care, better care to more people for less money? I'm sorry, the number you have reached is not a working number. Please hang up and dial again. That math doesn't work. The answer is, if we try to pay for health care using American private insurance companies, the only way to get more care or to include more people is to pay more money. Example, United Healthcare covers about 25 million people. Most of them are working adults, employed adults. They spend about 20% out of all the premium dollars on administration, and they employ about 35,000 people. Taiwan has a national health plan. It's about 25 million people. Their National Health Service spends 1% on administration, not 20%. They employ 2,000 people, not 35,000 people. What are those people at United Healthcare doing? Are they sitting around buffing their nails and reading racing form? No, they're very busy, because in the United States, every billable medical event needs to be evaluated by an insurance agent to determine, was the patient insured at that time? We have about a 30% churn rate in private and public insurance, which means there's a good chance that 2 years from now, that's not going to be your insurance company. Was that condition covered in your policy, in that patient's policy? Was the treatment covered for that condition? Was that physician authorized to provide that treatment? If pre-authorization was required, did the physician get pre-authorization? And did the treatment code match the procedure code? Now, and was the physician in network at the time? Now, all of that was previously done by the physician who had to complete all that paperwork, and then it gets reevaluated. And because private insurance companies reject 30% of all first claims, the physician gets to repeat that a third time 30% of the time. You can imagine the efficiency, the amount of money that we don't spend on insurance administration if everybody is covered. You're a human being, you're covered. That's pretty easy to determine. It's one set of benefit. Was it a treatable condition? And did you get treatment? That's covered. And are you licensed in the United States? You're in network. Now, that doesn't eliminate administrative costs. But the amount of money we recover from not filtering our money through these billers and administrators is more than the amount of money that we would spend to provide more care to more people. We pay insurance companies more to say no than we would pay providers to say yes. The next question you're going to be asked, well, what about all of the problems they're having in, insert your country name here?
Italy.
Good. I've been asked Belgium. Mostly it's going to be Canada. Now, it's taken me years to come up with some comprehension of the U.S. healthcare system, but it's not complete, and I certainly can't address problems in Italy or Belgium. So here's a generic answer, and Larry hinted at it before. Every healthcare system in the world is facing the same daunting challenge of increasing healthcare costs and decreasing willingness of patients and taxpayers to pay for it. Everywhere you go, it's the same thing. And every country has come up with its own modestly dysfunctional way of addressing that challenge. We could exchange our healthcare systems with any other developed country, and boy, would we have problems. We'd have different problems. We might have more problems. But no matter which country we exchanged with, we would provide better care to more people for less money. That's a lot to absorb. The summary is the content. Where are you going to start will be driven by where you think your audience is along the spectrum. And each one of these niches, some of which are outlined in that 3 questions, 9 answers essay, all of them can be broken down so you can fill 15 minutes just on that one topic. Sorry, there and then there.
Okay, what would be your answer to someone who would say, okay, Oregon gets single payer. What about all these people that are flocking in from the rest of the country to get free care?
Yes, if Oregon's the only state in the nation that has universal care, there'll be boxcars of people flocking into Oregon to enjoy our largesse. Well, first what we've discovered is when people leave one state to go to another, it's for employment and family. And that's for immigrants as well. If you look around the country to see where the social benefits are the best, that's not where people migrate. Now, will there be people who will come to Oregon and figure out a way to pay taxes in Oregon so they can enjoy Oregon's universal care? Yes. Will there be freeloaders? Yes. No one has yet designed a healthcare system that doesn't have freeloaders and have people who complain. That's not the goal. What we need is a healthcare system that's robust enough that we can have freeloaders and we can have people who can complain and still deliver better care to more people for less money. And that's the example around the world. I can tell you, there are people in Sweden who are complaining about their health care. And there are people in Sweden who aren't working, who are lying back in their hammocks, drinking beer and smoking cigarettes and saying, boy, I'm glad I live here and I get free medical care. And they still deliver better care to more people for less money. So the boxcar question should not deter us from being the first. The statistics tell us it's $10,000 per year per person in health care, but how many people here wrote a check for $10,000 last year for health care? That's an average. Not everybody in the country spends $10,000 a year. And in our lifetime, some years we don't spend anything at all. Also, it's sort of, the way we pay for health care is like being nibbled to death by 1,000 ducks. Just tiny little bites here and there. Our employer takes some money out. We have some deducted from our own paycheck. We pay deductibles, we pay co-pays, we pay for medications, some medications more than others. We go out of network. Very few of us could review in a year and total up how much we spent and then do it over the course of a lifetime. The goal of universal care isn't to reduce your health care costs today, but to reduce everyone's health care costs spread over the lifetime of the country. And in return, we know that we're not going to go bankrupt. We know that there's not going to be a labor management dispute over health care. We have security, and we know that, gee, I wrote out my check to the Oregon single payer system for $10,000 this year. That's terrible. But the next year, when I'm desperately sick, or a spouse gets cancer, or a child's in an automobile accident, it's still $10,000. And 20 years from now, when I'm older, sicker, less employed, and have less money, it's still the same. So if I'm paying more this year than I'm consuming in healthcare, I'm not paying for other people's healthcare. I'm prepaying for my own healthcare in the future, knowing that I'll be able to get it even when I can't afford it. By the way, when Ronald Reagan was governor of California, he ended the paycheck deductions for state income tax. And instead, he made sure every citizen of California got a bill for their state income tax, because he wanted people to see how much they paid in income tax all in one time and get outraged. And they did. If we did that for medical care and say, nobody's going to pay for it just today, we're going to keep the whole system as it is, but nobody's going to pay anything. You're just going to get billed at the end of the year for your premiums, for your co-pays, for your deductibles. That would make a statement.